Hi there, my name is Dr. Dennis Wolf and I'm going to talk to you about the aftercare for fat transfer. The majority of the aftercare is really very similar to VASA aftercare, which you can have a look at in a separate video. The difference is for the areas that are treated with a fat transfer. From this point of view, it's important to wear the support garments. In the face, I don't generally recommend wearing support garments. On the breast, you'll be wearing a support bra, and this needs to be worn for at least 3 weeks, 24 hours a day. It's obviously that you will take this off for showering and washing. And you can certainly have more than one garment to try and alternate these. The reason you wear the support garment is to make sure that you remember that you've had something done, you treat the areas delicately, and you also make sure that you sleep on your back. For areas like the buttocks, you'll be wearing a support or compression garment with a cutout for the area where the fat has been transferred into. Again, in this case, it's important not to lie on your back but lie on your front to minimize the amount of sitting you do for the first few months. And generally just look after and be gentle with the areas that have been treated. Again, I would insist on all my patients having manual lymphatic drainage, as this will improve the lymphatic flow through the areas that have been treated and minimize the risk of getting irregularities, lumps and bumps, and any form of deviations. During the aftercare recovery period, you will come and see me for at least 3 times. I generally like to see my patients immediately the next day to make sure that all is well. I then will see you again after about 10 days, then 4 weeks, and then again at 4 months. And like I've said before, I do not put a limitation onto the number of follow-up appointments that you can come and see me. You will get my mobile number after the procedure, so you can call me after hours or on weekends if the need arises. The importance with fat transfer is that you remain vigilant of the areas where the fat has been transferred to. If there is any sign of infection, any redness, you're feeling ill, any signs of flu type symptoms, those are important, and it's important to call me as soon as possible so we can assess the situation and see whether there is any need for a treatment. You will get a course of antibiotics and some painkillers. The antibiotics are again preventative, and generally these are started a day before the procedure. The painkillers are required purely just to take the edge off the discomfort that you'll experience in the first few days. From experience, patients will take these either anywhere from 1 day to about 4 days, depending on your threshold of discomfort. To return to normal levels of activity, that depends on patients themselves, and that can take anywhere from 1 day to 3 days. You should be able to get back into your normal household routines pretty much the next day. With regards to getting back into formal exercise, I recommend taking at least 3 days of not going back to gym, but prior to that you can remain active and certainly do lots of walking and possibly start a bit of yoga or cycling. So in summary, for fat transfer, the aftercare is really important. Remember that you're having live tissue transferred from one area to another, so it's important to remain vigilant. And if you have any queries, call me immediately or come and see me at the clinic.